Silent reflux. No more, understand it now and take control of your life. Stop coughing and finally live. It is an extraordinary pleasure and honor for me to present to you this book, which was created in close collaboration with my wonderful team. Together we have set ourselves the goal of creating a work that is not only informative, but also offers hope and concrete solutions for people who struggle with silent reflux. As an author and expert in the field of health and medical therapies, it is my personal concern to make complex medical topics understandable and accessible. But without the support and expertise of my team, this book would never have been written. I would like to thank my team from the bottom of my heart for their tireless work and passion for this project. Their expertise and dedication have made it possible to produce a wealth of, to compile information and practical advice to help people understand and manage their silent reflux and ultimately live a symptom-free life. What is silent reflux? Silent reflux, also known as laryngopharyngeal reflux, LPR, or extraesophageal reflux, is a form of gastroesophageal reflux, GERD, characterized by the backflow of stomach acid and stomach contents into the upper respiratory tract and throat. Unlike classic GERD, in which heartburn is the dominant symptom, silent reflux often does not cause typical stomach discomfort. Instead, the effects of reflux are mainly noticeable through symptoms in the throat area. The causes of silent reflux are varied and can include anatomical, physiological and lifestyle-related factors. The most common causes include weakness of the lower esophageal sphincter, LES. The LES is a muscle at the bottom of the esophagus that normally prevents stomach acid from flowing back into the esophagus. Weakening of this muscle can allow stomach acid to more easily enter the upper airway. Hiatal hernia. A hiatal hernia is a condition in which part of the stomach protrudes through the diaphragm into the chest cavity. This can interfere with the normal closure mechanism of the esophageal sphincter. Dietary habits. Consumption of acidic foods and beverages such as citrus fruits, tomato products, coffee, alcohol and spicy foods can aggravate reflux. Obesity. Obesity increases pressure in the abdominal cavity, which can promote the reflux of stomach acid. Smoking. Smoking can reduce the production of saliva, which normally neutralizes acid and protects the esophagus. It can also weaken the LES and affect the movement of the stomach. The symptoms of silent reflux can vary, but they mainly affect the neck and throat area. These include chronic throat clearing, persistent cough, especially at night or after eating, hoarseness or changes in voice, globus sensation in the throat, the feeling of a lump or foreign body, sore throat or chronic sore throat, difficulty swallowing, sore throats or inflammation of the vocal cords. Diagnosing silent reflux can be challenging because the symptoms are often subtle and can be confused with other conditions affecting the throat and pharynx. A thorough medical history, physical examination, and various diagnostic tests such as endoscopy, pH metry test, or manometry can help confirm the diagnosis. Treatment for silent reflux aims to reduce the reflux of stomach acid and relieve symptoms. This can be achieved through a combination of lifestyle changes, drug therapy and, in some cases, surgical intervention. It is important that treatment is individually tailored to each patient to achieve the best results and minimize the risk of complications. In the following chapters, we will take a closer look at the different treatment options for silent reflux and help you develop a holistic approach to managing this condition. Causes and risk factors. The causes and risk factors for silent reflux are varied and can vary from person to person. However, there are some common factors that can increase the risk of developing this condition. Weakness of the lower esophageal sphincter. LE. The LE is a muscle at the bottom of the esophagus that normally prevents stomach acid from flowing back into the esophagus. A weakening of this muscle can allow stomach acid to enter the upper airway more easily. This weakness can be caused by several factors, including obesity, smoking, certain medications, and anatomical abnormalities. Hiatal hernia. A hiatal hernia occurs when part of the stomach protrudes into the chest cavity through a gap in the diaphragm. This can interfere with the normal closure mechanism of the esophageal sphincter, allowing stomach acid to reflux. Overweight and obesity. Overweight and obesity increase pressure in the abdomen, which can facilitate the reflux of stomach acid into the esophagus. In addition, excess fatty tissue can produce pro-inflammatory substances that can increase reflux. Dietary habits. Consumption of acidic foods and drinks such as citrus fruits, tomato products, coffee, alcohol and spicy foods can worsen reflux. Likewise, large meals, fatty foods and eating meals close to bedtime can increase pressure in the stomach and encourage the reflux of stomach acid. Smoking. Smoking can weaken the LE and decrease the production of saliva, which normally neutralizes acid and protects the esophagus. In addition, smoking can increase inflammation in the esophagus and impair the movement of the stomach, which can worsen reflux. Certain medications. Some medications can relax the LE or increase the production of stomach acid, which can promote stomach acid reflux. These include certain pain relievers, NSAIDs, calcium channel blockers, nitrates, antidepressants, bisphosphonates, and some antibiotics. Anatomical abnormalities. Congenital or acquired abnormalities of the esophagus or stomach can interfere with the normal flow of food and stomach acid and promote reflux. It is important to note that not everyone who has one or more of these risk factors will necessarily develop silent reflux. The development of this condition depends on a variety of factors, including genetic predisposition, lifestyle and environmental factors. However, it is advisable to be aware of these risk factors and, if necessary, take steps to reduce the risk of silent reflux. Symptoms and diagnosis. The symptoms of silent reflux can vary and are often more subtle than the symptoms of typical GERD, gastroesophageal reflux disease. Because there is less or no heartburn with silent reflux, the symptoms are often not associated with stomach problems. Instead, they often manifest in the throat and pharynx area and in the airways. Here are some of the most common symptoms of silent reflux. Chronic cough. A persistent cough that does not respond to conventional treatments is a common symptom of silent reflux. The cough often occurs after eating and can be particularly distressing when lying flat. Chronic throat clearing. Individuals with silent reflux tend to clear or throat frequently without any apparent reason. This can cause the vocal cords to become irritated and cause hoarseness. Hoarseness or changes in voice. Irritation of the vocal cords by refluxing gastric juices can lead to hoarseness or a change in voice. This can be expressed by a hoarse or deep voice. Globus sensation in the throat. Many people with silent reflux experience an uncomfortable feeling in the throat, often described as a lump in the throat or globus sensation. It feels as if there is a foreign object stuck in the throat that cannot be swallowed. Sore throat or chronic sore throat. Irritation of the mucous membranes in the throat by refluxing gastric juices can cause a sore throat or chronic inflammation in the throat. Difficulty swallowing. People with silent reflux may have difficulty swallowing solid foods or liquids, especially when the reflux of gastric juice is acute. Coughing or wheezing at night. The coughing or wheezing may be particularly severe at night when the person lies down and the reflux of gastric juices is facilitated. Diagnosing silent reflux can be challenging because the symptoms are often non-specific and can be confused with other conditions in the throat and pharynx. A thorough history and physical examination are crucial to confirm the suspicion of silent reflux. In addition, several diagnostic tests can be performed to confirm the diagnosis. These include endoscopy. This test involves inserting a flexible tube with a tiny camera endoscope through the mouth into the esophagus to check the condition of the mucous membranes and detect any signs of inflammation or damage. pH metry. This test measures the acidity in the esophagus over a 24-hour period. Increased acidity may indicate silent reflux. Manometry. This test measures pressure in the esophagus and can help determine whether the lower esophageal sphincter is functioning properly. Barium swallow study. In this test, the patient is asked to drink a barium solution while X-rays are taken. This allows doctors to observe the flow of fluid through the esophagus and identify abnormalities. Accurate diagnosis and treatment of silent reflux often requires collaboration between various healthcare professionals, including primary care physicians, gastroenterologists, otolaryngologists, and nutritionists. It is important not to ignore symptoms and to receive timely diagnosis and treatment to avoid long-term complications. The traditional treatment of silent reflux. Traditional treatment for silent reflux focuses primarily on reducing the reflux of stomach acid, relieving symptoms, and preventing long-term complications. Here are some of the common treatment methods. Drug therapy. Proton pump inhibitors, PPIs. These medications block the production of stomach acid and can help reduce the reflux of stomach acid into the esophagus. They are often the first choice in treating silent reflux. H2 receptor antagonists. These medications also reduce the production of stomach acid but are less effective than PPIs. However, they can be used in milder cases or for long-term therapy. Antacids. Antacids neutralize stomach acid and can provide temporary relief from heartburn and other symptoms. They are often taken when needed. Dietary change. A modified diet can help reduce the reflux of stomach acid and relieve the symptoms of silent reflux. This includes avoiding acidic foods and drinks such as citrus fruits, tomato products, coffee, alcohol and spicy foods. Eating smaller meals and not eating right before bedtime can also help. Lifestyle changes. Smoking cessation. Smoking can weaken the liver and promote the reflux of stomach acid, so quitting smoking can be an important measure to improve symptoms. Weight loss. Being overweight increases pressure in the abdominal cavity and can increase the reflux of stomach acid. Losing weight can therefore help to alleviate symptoms. Avoiding trigger factors. Certain activities or habits such as spicy foods, carbonated drinks, alcohol or certain medications can make reflux worse. Therefore, identifying and avoiding these trigger factors can help reduce symptoms. Adjusting sleep habits. Elevating the upper body while sleeping can help reduce the reflux of stomach acid. This can be achieved by raising the head of the bed or using a wedge pillow. Stress management and relaxation techniques. Stress can increase the reflux of stomach acid and worsen the symptoms of silent reflux. Therefore, learning stress management and relaxation techniques such as yoga, meditation or progressive muscle relaxation can help reduce symptoms. It is important to stress that the treatment of silent reflux should be tailored to each patient individually. What is effective for one person may not work for another. It is therefore important to work closely with a doctor or team of professionals to find the best possible treatment and avoid long-term complications. In some cases, surgical intervention may also be necessary, especially when conservative measures are not sufficient or complications arise. Medications and how they work. Treatment for silent reflux often involves the use of various medications aimed at reducing the reflux of stomach acid and relieving the associated symptoms. Here are some of the commonly used medications and how they work. Proton pump inhibitors, PPIs. Examples: omeprazole, pantoprazole, esomeprazole, lansoprazole, rabeprazole. How it works. PPIs inhibit the proton pumps in the cells of the stomach that are responsible for the production of stomach acid. This inhibition reduces the production of stomach acid, which helps reduce the reflux of stomach acid into the esophagus. They are the most effective medications for treating silent reflux. H2 receptor antagonists. Examples: ranitidine, famotidine, cimetidine. How it works. H2 receptor antagonists block the action of histamine, a chemical messenger that stimulates the production of stomach acid. By blocking the H2 receptors, the production of stomach acid is reduced, which helps reduce reflux. These drugs are less effective than PPIs, but are used in some cases, especially in patients with milder symptoms or for long-term therapy. Antacids. Examples: Maalox, Mylanta, Tums, Rolaids. How it works. Antacids contain basic compounds such as calcium carbonate, magnesium hydroxide or aluminum hydroxide that neutralize stomach acid, providing temporary relief from heartburn and other symptoms. They work quickly but are not very effective at reducing the reflux of stomach acid, so they are often used in combination with other medications. Prokinetics. Examples: metoclopramide, domperidone. How they work. Prokinetics promote movement of the stomach and digestive tract, which helps reduce the reflux of stomach acid and speeds up gastric emptying. They are used in some cases to treat reflux, especially when there is also a delay in gastric emptying. It is important to note that the effects and tolerability of medications may vary from person to person, so it is advisable to work closely with a doctor to find the most appropriate medication and dosage for each individual patient. In addition, medications to treat silent reflux should usually only be used for a limited period of time and should not be considered a long-term solution. Long-term control of symptoms often also requires lifestyle changes and additional treatment measures if necessary. Lifestyle changes to relieve symptoms. Lifestyle changes play a crucial role in the treatment of silent reflux and can help relieve symptoms and prevent long-term complications. Here are some important lifestyle changes that may be recommended. Dietary change. Avoid acidic foods and drinks such as citrus fruits, tomato products, coffee, alcohol, Spicy spices and carbonated drinks, as they can encourage the reflux of stomach acid. Reduce consumption of fatty and spicy foods, which can irritate the stomach and worsen reflux. Eat smaller meals and avoid eating large meals close to bedtime to reduce pressure in the stomach and minimize reflux of stomach acid. Weight loss. Overweight and obesity increase pressure in the abdominal cavity, which can encourage the reflux of stomach acid. Losing weight can therefore help relieve the symptoms of silent reflux. Smoking cessation. Smoking weakens the lower esophageal sphincter, and increases the production of stomach acid, which promotes gastric acid reflux. Therefore, quitting smoking can be an important measure to improve symptoms. Avoiding trigger factors. Identify personal trigger factors that may trigger or worsen your symptoms and try to avoid them. These include certain foods, drinks, medications, or certain activities. Sleep hygiene. Consider elevating your upper body while sleeping to reduce reflux of stomach acid. This can be achieved by raising the head of the bed or using a wedge pillow. Avoid heavy meals close to bedtime and give your body enough time to digest the meal before lying down. Stress management. Stress can increase the reflux of stomach acid and worsen the symptoms of silent reflux. So learning stress management techniques such as meditation, yoga, deep breathing, or progressive muscle relaxation can help relieve symptoms. It is important to stress that lifestyle changes should often be considered part of a holistic treatment approach and can be used in combination with other treatment methods such as medication or therapy. Implementing these lifestyle changes often requires patience and commitment, but they can have a significant impact on controlling the symptoms of silent reflux and lead to an improvement in quality of life in the long term. The limits of conventional therapy approaches. Despite the effectiveness and widespread use of conventional therapeutic approaches to treat silent reflux, there are some limitations that must be considered. Side effects of medications. While medications such as proton pump inhibitors, PPIs, can be effective, they are not free of side effects. Long-term use of PPIs can lead to an increased risk of bone fractures, kidney disease, vitamin deficiencies, and infections. In addition, some people may experience unwanted side effects such as headaches, diarrhea, nausea, or stomach upset. Rebound symptoms. Suddenly stopping PPIs can cause symptoms to return, often in a more severe form. This is called a rebound symptom and can increase dependence on medications. Inadequate symptom control. In some patients, conventional treatment approaches may not provide adequate control of the symptoms of silent reflux. This may result in patients' quality of life being compromised and continued distressing symptoms. Long-term dependence on medications. Some patients may rely on medications long-term to control their symptoms without exploring other possible treatment options or addressing the underlying causes of reflux. Risk of complications. Although conventional treatment approaches can help relieve symptoms and prevent complications, there is still some risk of long-term complications such as Barrett's esophagus, a precancerous condition of the esophagus, or esophagitis, inflammation of the esophagus. Individual differences. Each patient responds differently to different treatment methods, and what is effective for one patient may not work for another. It is important to consider individual differences and needs and to offer tailored treatment. Given these limitations and challenges, It is important that patients and physicians remain open to alternative therapeutic approaches and seek holistic treatments that can not only relieve symptoms but also address the underlying causes of reflux. An integrative approach that includes lifestyle changes, nutritional optimization, stress management, alternative therapies, and complementary treatments when appropriate can help improve treatment effectiveness and achieve long-term results. Long-term effects of medications. Long-term use of certain medications, particularly proton pump inhibitors, PPIs, can have various effects on the body. Here are some of the long-term effects that may occur associated with long-term use of medications to treat silent reflux. Osteoporosis and bone fractures. Long-term use of PPIs may increase the risk of osteoporosis and bone fractures, especially in older people or people with other risk factors for osteoporosis. PPIs may interfere with the body's absorption of calcium, which may lead to a reduction in bone density in the long term. Kidney disease. Studies have shown that long-term use of PPIs may be associated with an increased risk of kidney disease, including acute interstitial nephritis, an inflammation of the kidneys. Vitamin and nutrient deficiencies. Long-term use of PPIs can impair the absorption of certain vitamins and nutrients, particularly vitamin B12, magnesium, and iron. Deficiencies in these nutrients can lead to a variety of health problems, including anemia, fatigue, muscle weakness, and neurological problems. Risk of infection. PPIs may increase the risk of gastrointestinal infections, including infection with the bacteria Clostridium difficile, C. difficile, which can cause severe diarrhea. Increased risk of dementia. Some studies have found an association between long-term PPI use and an increased risk of dementia, although the exact mechanism of this association is not yet fully understood and further research is needed. Drug dependence. Long-term use of PPIs can lead to drug dependence, as abruptly stopping PPIs can cause symptoms to return, often in a more severe form. This can lead patients to continue taking PPIs even when they may no longer be needed. It is important to stress that not all patients taking PPIs will experience long-term side effects, and that the benefits of treatment often outweigh the risks, especially when PPIs are used short-term and under medical supervision. Nevertheless, it is important to consider the potential long-term effects of medications and to explore alternative treatment options, especially in patients who must take PPIs long-term. Regular monitoring and communication with a doctor are crucial to ensure the right treatment for each individual patient and to minimize long-term complications. Challenges in implementing lifestyle changes. Implementing lifestyle changes to manage silent reflux can present several challenges to overcome. Here are some of the most common challenges. Motivation and perseverance. Changing your lifestyle often requires considerable motivation and discipline, especially when it comes to changing long-term habits. It can be difficult to give up old eating habits or quit smoking, especially when the results are not immediate. Social and cultural influences. Social and cultural influences can make it difficult to implement lifestyle changes. Societal expectations, eating habits in the family or at social events, and cultural traditions can make it difficult to implement certain changes. Lack of time and resources. Lifestyle adjustments often require time, planning and resources. Stressful daily routines and work commitments can make it difficult to prepare healthy meals, exercise regularly, or manage stress. Temptations and temptations. Temptations such as tempting foods, social invitations, or stress can cause individuals to deviate from their healthy habits and return to old habits. Lack of knowledge or support. A lack of knowledge about healthy lifestyle habits or a lack of support from family, friends, or healthcare professionals can make it difficult to implement lifestyle changes. Frustration and setbacks. Frustration over lack of progress or setbacks can cause people to give up their efforts or feel discouraged. Psychological barriers. Psychological factors such as anxiety, depression, stress, or emotional eating can hinder the implementation of lifestyle changes and affect motivation. It is important to acknowledge these challenges and develop strategies to overcome them. This may include building support systems, developing coping strategies for stress and temptation, finding alternatives to cultural or social influences, and implementing changes gradually to avoid becoming overwhelmed. A positive attitude, patience, and self-care are also critical to success in implementing lifestyle changes. The new therapy for silent reflux. The new therapy for silent reflux is based on a holistic approach that aims not only to relieve symptoms, but also to address the underlying causes of reflux and promote long-term health improvements. This therapy includes several elements that work together to reduce the reflux of stomach acid and improve the quality of life of those affected. Dietary optimization. A central component of the new therapy for silent reflux is adjusting the diet to avoid acidic foods and drinks that can encourage the reflux of stomach acid. Instead, a diet rich in fiber-rich foods, fruits, vegetables, and lean protein is recommended to aid digestion and soothe the stomach. Lifestyle changes. The new therapy also includes promoting lifestyle changes such as smoking cessation, weight reduction in those who are overweight, stress management techniques, and optimizing sleep patterns. These changes help reduce pressure in the abdomen, regulate the production of stomach acid, and minimize the reflux of stomach acid. Medication management. The use of medications, particularly proton pump inhibitors, PPIs, is often used more cautiously in new therapy for silent reflux. When medications are required, they are often prescribed for the short term and at lower doses to reduce the risk of long-term side effects. Naturopathy and alternative therapies. Naturopathy and alternative therapies can play an important role in the treatment of silent reflux. These include, for example, taking probiotic, dietary supplements to promote healthy intestinal flora, the use of herbs such as aloe vera to soothe the stomach lining, and the use of homeopathic remedies to relieve symptoms. Exercise and physical activity. Regular exercise and physical activity can help support the digestive process, regulate metabolism, and reduce stress, all of which help reduce the reflux of stomach acid and relieve the symptoms of silent reflux. Treating underlying causes. New therapy for silent reflux also places emphasis on identifying and treating underlying causes of reflux, such as hiatal hernias, lower esophageal sphincter weakness, or anatomical abnormalities. This may require the integration of diagnostic procedures such as endoscopy, pH metry, or manometry to determine the exact cause of reflux and enable tailored treatment. Overall, the new therapy for silent reflux aims to provide a holistic treatment that relieves symptoms, improves quality of life and promotes long-term health improvements. By combining nutritional optimization, lifestyle changes, medication management, naturopathy, exercise and treating the underlying causes, individuals with silent reflux can receive comprehensive and effective treatment tailored to their individual needs. Basics of the new therapy. The foundation of the new therapy for silent reflux is based on a holistic approach that aims to address the underlying causes of reflux and promote long-term health improvements. Here are some of the basic principles of this therapy. Individualization of treatment. Each patient with silent reflux is unique, and therefore therapy requires an individualized approach tailored to the specific needs, symptoms and causes of each patient. This may include a thorough diagnosis and a comprehensive evaluation of the medical history to develop the right treatment strategy. Nutritional optimization. A healthy diet plays a crucial role in the treatment of silent reflux. Therapy includes optimizing the diet to avoid acidic foods and drinks that can promote reflux of stomach acid. Instead, fiber-rich foods, fruits, vegetables and lean proteins are recommended to aid digestion and soothe the stomach. Lifestyle changes. Therapy also includes encouraging lifestyle changes such as smoking cessation, weight loss for those who are overweight, stress management techniques, and optimizing sleep patterns. These changes can help reduce abdominal pressure, regulate stomach acid production, and minimize stomach acid reflux. Medication management. The use of medications, particularly proton pump inhibitors, PPIs, is often used more cautiously in new therapy for silent reflux. When medications are required, they are often prescribed for the short term and at lower doses to reduce the risk of long-term side effects. Naturopathy and alternative therapies. Therapy may also include alternative treatment approaches such as naturopathy, herbal medicine, acupuncture or homeopathy, which can help relieve symptoms and improve health without the side effects of medication. Exercise and physical activity. Regular exercise and physical activity play an important role in the treatment of silent reflux. These can help support the digestive process, regulate metabolism, and reduce stress, all of which help reduce the reflux of stomach acid and relieve symptoms. Treating underlying causes. New therapy for silent reflux places particular emphasis on identifying and treating the underlying causes of reflux, such as anatomical abnormalities, hiatal hernias, or weakness of the lower esophageal sphincter. By treating these causes, long-term improvement in symptoms and health can be achieved. Overall, the new therapy for silent reflux aims to provide a comprehensive and holistic treatment that not only relieves symptoms, but also treats the underlying causes of reflux and promotes long-term improvements in health. By integrating nutritional optimization, lifestyle changes, medication management, naturopathy, exercise, and treating the underlying causes, individuals with silent reflux can receive effective and tailored treatment that addresses their individual needs. Treatment methods in detail. Treatment methods for silent reflux can be varied and include different approaches aimed at relieving symptoms and treating the underlying causes of reflux. Here are some of the treatment methods in detail. Nutritional optimization. Reduction of acidic foods and drinks. This includes citrus fruits, tomato products, carbonated drinks, coffee and spicy spices, which can promote the reflux of stomach acid. Avoid fatty and spicy foods. These can irritate the stomach and worsen reflux. Eating small meals. This reduces pressure in the stomach and can reduce the reflux of stomach acid. Avoiding meals close to bedtime. This will reduce stomach acid production and minimize reflux while sleeping. Lifestyle changes. Quitting smoking. Smoking weakens the lower esophageal sphincter and increases the production of stomach acid, which can worsen reflux. Weight loss. Being overweight increases pressure in the abdominal cavity and can worsen reflux. Stress management. Stress can increase reflux, so techniques such as meditation, yoga or progressive muscle relaxation are helpful. Sleep hygiene. Elevating the upper body while sleeping can reduce reflux. Drug therapy. Proton pump inhibitors, PPIs. These medications reduce the production of stomach acid and are often used for the short-term treatment of silent reflux. H2 receptor antagonists. These medications block the action of histamine, which stimulates the production of stomach acid. Antacids. They neutralize stomach acid and provide temporary relief from heartburn and other symptoms. Naturopathy and alternative therapies. Probiotics. They can support the intestinal flora and strengthen the immune system. Herbal medicine. Aloe vera, chamomile and ginger can have a soothing effect on the stomach lining. Acupuncture. This traditional Chinese therapy can help balance the gastrointestinal tract and reduce reflux. Surgical treatment. Fundoplication. A surgery in which the upper part of the stomach is wrapped around the lower esophageal sphincter to prevent reflux. Linx procedure. A procedure in which a small ring implant is placed around the lower esophageal sphincter to prevent the reflux of stomach acid. It is important to emphasize that the choice of treatment methods depends on several factors, including the severity of symptoms, the individual needs of the patient, and the underlying causes of reflux. A comprehensive approach that includes nutritional optimization, lifestyle changes, drug therapy, and surgical intervention when appropriate can often produce the best results for patients with silent reflux. Working with a doctor or specialist is crucial to finding the right treatment and promoting long-term improvements in health. Dietary change. Dietary changes play a crucial role in the treatment of silent reflux and can help relieve symptoms and promote long-term health improvements. Here are some important aspects of dietary changes for people with silent reflux. Avoid acidic foods and drinks. Acidic foods and drinks can encourage the reflux of stomach acid and increase the symptoms of silent reflux. These include citrus fruits such as oranges and lemons, tomato products, carbonated drinks, coffee and spicy spices. It is advisable to avoid these foods and drinks or reduce their consumption. Reducing fatty and spicy foods. High-fat foods such as fried foods, fatty meats and high-fat dairy products can irritate the stomach and worsen reflux. Spicy foods and foods high in chili, garlic or onions can also trigger symptoms. It is advisable to consume these foods in moderation or replace them with lighter alternatives. Eating small meals. Eating large meals can overload the stomach and increase pressure in the abdomen, which encourages the reflux of stomach acid. Instead, it is advisable to eat smaller meals throughout the day to reduce the load on the stomach and relieve the symptoms of silent reflux. Avoiding meals close to bedtime. Eating heavy meals close to bedtime can put pressure on the stomach and increase reflux while you sleep. It is recommended to avoid eating large meals at least 2 to 3 hours before bedtime to facilitate digestion and minimize reflux of stomach acid. Increase fiber and water intake. Eating a diet rich in fiber can help promote digestion and prevent constipation, which can increase abdominal pressure and worsen reflux. It is important to consume enough fiber from fruits, vegetables, whole grains and legumes, and drink plenty of water to aid digestion and relieve the symptoms of silent reflux. Avoid alcohol and nicotine. Alcohol and nicotine can increase the production of stomach acid and relax the lower esophageal sphincter, which promotes the reflux of stomach acid. It is recommended to avoid alcohol and tobacco smoke or reduce their consumption to relieve the symptoms of silent reflux. Switching to a healthy and balanced diet can make a significant contribution to the treatment of silent reflux and help to reduce symptoms and promote long-term improvements in health. It is important to identify individual trigger factors and develop a diet that is tailored to the individual patient's needs and symptoms. If required, nutritional advice or support from a nutritionist can be helpful in achieving optimal dietary changes. Breathing techniques and relaxation techniques. Breathing and relaxation techniques can play an important role in managing silent reflux as they can help reduce stress, relax the body, and relieve symptoms. Here are some effective breathing and relaxation techniques that can be helpful in treating silent reflux. Diaphragmatic breathing. This breathing technique focuses on breathing deeply into the abdomen rather than shallowly into the chest. Place one hand on the abdomen and the other hand on the chest. Breathe in deeply through the nose, feeling the abdomen expand while the chest barely moves. Hold the breath briefly, then breathe out slowly through the mouth while slightly contracting the abdominal muscles. This technique helps to relax the body and strengthen the respiratory muscles, which can reduce pressure in the abdomen. Progressive muscle relaxation. PMR. This method involves consciously tensing and relaxing different muscle groups in the body to achieve deep relaxation. Start with the toes and slowly work your way through the body, tensing each muscle tightly for about 5 seconds and then relaxing for about 15 seconds. Focus on the sensations of relaxation in the muscles and breathe calmly and evenly. PMR can help relieve physical tension and lower stress levels, which can counteract reflux symptoms. Yoga and Tai Chi. These practices combine breath control, physical movement, and relaxation techniques to calm the body and mind. Yoga and Tai Chi exercises can help improve flexibility, relax muscles, and reduce stress, which can help relieve the symptoms of silent reflux. Meditation and mindfulness exercises. Meditation techniques, such as focusing on breathing or repeating calming mantras, as well as mindfulness exercises that involve focusing on the present and letting go of negative thoughts, can help calm the mind and reduce stress. This can help reduce abdominal pressure and relieve symptoms of silent reflux. Breathing exercises for acute symptoms. For acute symptoms of silent reflux, such as acid reflux or a lump in the throat, rapid breathing exercises can help reduce reflux. Try breathing in slowly and deeply through your nose and then breathing out slowly through your mouth while concentrating on breathing out. Repeat this several times to calm the body and relieve symptoms. Regular practice of breathing and relaxation techniques can help lower stress levels, reduce muscle tension, and relieve symptoms of silent reflux. It is important to find the techniques that best suit individual needs and preferences and to incorporate them into your daily routine on a regular basis to promote long-term health improvements. Physiotherapy and exercise therapy. Physical therapy and exercise therapy can be important components in the treatment of silent reflux, as they can help improve gastrointestinal function, strengthen muscles, reduce abdominal pressure, and relieve symptoms. Here are some ways physical therapy and exercise therapy can be used in the treatment of silent reflux. Breathing and movement exercises. A physical therapist can guide you through specific breathing and movement exercises that help strengthen the muscles of the gastrointestinal tract and aid digestion. These include abdominal breathing techniques, targeted stretches for the abdominal muscles, and gentle movements that reduce pressure in the abdomen. Manual therapy. Through targeted manual techniques, a physical therapist can help release tension and adhesions in the abdominal and chest area that can affect the gastrointestinal tract. This can help relieve pressure on the stomach and reduce the reflux of stomach acid. Posture correction. Poor posture, especially hunched over posture, can increase abdominal pressure and increase reflux. A physical therapist can help improve correct posture and strengthen muscles to reduce abdominal pressure. Whole body exercise therapy. Regular physical activity can help regulate metabolism, control body weight, and reduce stress, all of which can help relieve the symptoms of silent reflux. A physical therapist can help develop an individualized exercise plan that takes into account the patient's needs and limitations. Relaxation exercises. In addition to physical exercises, a physical therapist can also guide relaxation exercises such as progressive muscle relaxation, yoga or tai chi to reduce stress and relax the body. This can help reduce abdominal pressure and relieve the symptoms of silent reflux. Biofeedback therapy. This therapy method teaches the patient how to control the activity of certain muscles through feedback about body processes. This can help regulate muscle tone in the gastrointestinal tract and relieve the symptoms of silent reflux. By incorporating physical therapy and exercise therapy into the treatment plan, individuals with silent reflux can receive comprehensive and effective therapy aimed at strengthening the gastrointestinal tract, reducing stress, and improving quality of life. It is important to work with a qualified physical therapist to develop an individualized treatment plan that meets the patient's needs and goals. Alternative treatment approaches. Alternative treatment approaches can be a valuable addition or alternative to conventional therapies for silent reflux. Here are some alternative treatment approaches that can help relieve symptoms and improve quality of life. Acupuncture. This traditional Chinese therapy involves placing fine needles at specific points on the body to regulate energy flow and improve physical and emotional health. Acupuncture can help balance the gastrointestinal tract, improve gastric motility, and reduce reflux. Homeopathy. Homeopathic remedies are made from natural substances and can help relieve the symptoms of silent reflux. For example, remedies such as nux vomica can help with acid reflux and heartburn, while carbo vegetabilis can help with gas and bloating. However, the correct choice and dosage of homeopathic remedies should always be discussed with an experienced homeopath. Herbal medicine. Various herbs can have a soothing effect on the gastrointestinal tract and help relieve the symptoms of silent reflux. Herbs commonly used in the treatment of reflux include aloe vera, chamomile, ginger and licorice root. These can be taken in the form of teas, supplements or essential oils. Probiotics. Probiotics are beneficial bacteria that can support the gut flora and strengthen the immune system. A healthy gut flora can help reduce inflammation in the gastrointestinal tract and relieve reflux. Probiotics can be taken in the form of supplements that are specifically formulated for the gastrointestinal tract. Relaxation techniques. Relaxation exercises such as meditation, yoga, tai chi and progressive muscle relaxation can help reduce stress, reduce muscle tension and relieve the symptoms of silent reflux. Regular relaxation practices can put the body in a state of calm and balance, which can have a positive effect on the gastrointestinal tract. Chiropractic. Chiropractic treatments can help improve spinal alignment and relieve tension in the back and neck that can affect the gastrointestinal tract. Improved spinal alignment can optimize digestive tract function and reduce reflux. Before using alternative treatment approaches, it is important to speak with a qualified healthcare provider to make an informed decision and consider potential risks and interactions with other therapies. A holistic approach that combines conventional and alternative treatment approaches can often produce the best results in treating silent reflux. Case studies of successful treatments. Case Study 1. Sarah, 38 years old, had been suffering from chronic cough, hoarseness and a constant feeling of a lump in her throat for several years. After several visits to different doctors and tests, she was diagnosed with silent reflux. She decided to take a holistic treatment approach that included nutritional optimization, lifestyle changes and alternative therapies. Under the guidance of a nutritionist, she began to avoid acidic foods and change her diet to include high-fiber foods, fruits and vegetables. She also learned relaxation techniques such as meditation and progressive muscle relaxation to reduce her stress levels. In addition, she took probiotic supplements and started regular exercise such as yoga and outdoor walks. Within several weeks, Sarah noticed a significant improvement in her symptoms. Her cough became less frequent, her voice became clearer and the feeling of a lump in her throat almost completely disappeared. She felt more energetic and was finally able to live without discomfort again. Case Study 2. Michael, 45 years old, had been suffering from heartburn, acid reflux and occasional hiccups for years. Despite taking medications such as proton pump inhibitors, PPIs, his symptoms were not fully under control. After a comprehensive discussion with his doctor, Michael decided to use a combination of conventional and alternative therapy. He began adjusting his diet by avoiding acidic foods and fatty foods. In addition, he took homeopathic remedies on the recommendation of his homeopath and started regular acupuncture sessions. In addition, he started targeted exercise therapy under the guidance of a physiotherapist, aimed at strengthening his abdominal muscles and improving his posture. Within a few months, Michael reported a significant reduction in his reflux symptoms. His heartburn became less frequent, acid reflux hardly occurred at all and his hiccups disappeared completely. He felt better overall and was grateful for the holistic treatment that had helped him improve his quality of life. These case studies illustrate how comprehensive and individualized treatment, combining conventional and alternative therapy approaches, can help relieve the symptoms of silent reflux and help sufferers live a symptom-free life. It is important that each treatment plan is tailored to the patient's individual needs and circumstances to achieve the best results. Tips for a pain-free life. Here are some tips for a symptom-free life with silent reflux. Nutritional optimization. Avoid acidic foods and drinks such as citrus fruits, tomato products, carbonated drinks, coffee and spicy spices. Instead, consume high-fiber foods, fruits, vegetables and lean proteins. Small meals. Eat smaller meals throughout the day to reduce pressure in the stomach and minimize the reflux of stomach acid. Avoiding meals before bedtime. Avoid eating large meals at least 2 to 3 hours before bedtime to facilitate digestion and minimize reflux while sleeping. Weight control. Being overweight can increase pressure in the abdomen and increase reflux. Try to maintain a healthy body weight or lose weight if necessary. Quitting smoking. Smoking weakens the lower esophageal sphincter and increases the production of stomach acid, which can worsen reflux. Try quitting smoking to relieve your symptoms. Stress management. Stress can make reflux worse. Learn relaxation techniques such as meditation, progressive muscle relaxation or yoga to reduce stress and relieve your symptoms. Posture. Maintain good posture, especially when sitting and standing. An upright posture can reduce pressure in the abdomen and minimize reflux. Exercise and physical activity. Regular exercise can help regulate metabolism, control body weight, and reduce stress, all of which can help relieve the symptoms of silent reflux. Sleep hygiene. Sleep with your upper body elevated by placing an extra pillow under your upper back area. This can help minimize the reflux of stomach acid while you sleep. Consult your doctor regularly. Stay under regular medical care and discuss any changes in your symptoms or treatment approaches with your doctor. A doctor can help you adjust your treatment plan to achieve the best possible results. By following these tips and making lifestyle adjustments, you can help reduce the symptoms of silent reflux and live a symptom-free life. It is important that you take a holistic approach to treating silent reflux based on your individual needs and circumstances. Self-help strategies in everyday life. Here are some self-help strategies you can use in your daily life to relieve the symptoms of silent reflux and live a symptom-free life. Keep a food diary. Keep a diary of your eating habits and the symptoms you experience. This can help you identify potential triggers for your silent reflux and avoid certain foods or drinks that make your symptoms worse. Small meals. Eating smaller portions at meals and avoiding eating too much at once can reduce pressure in the stomach and minimize reflux. Eat calmly. Take your time with your meals and chew thoroughly. Eat in a relaxed environment without rushing or talking too much while eating to aid digestion and reduce reflux. Upright posture when eating. Sit upright during meals and avoid lying down immediately after eating. An upright posture can help reduce pressure in the stomach and minimize the reflux of stomach acid. Weight control. If you are overweight, reducing your body weight can help reduce abdominal pressure and relieve the symptoms of silent reflux. Stress management. Learn relaxation techniques such as meditation, breathing exercises or progressive muscle relaxation to reduce stress and relieve the symptoms of silent reflux. Healthy lifestyle. Live a healthy lifestyle by incorporating regular exercise into your daily routine, getting enough sleep, and avoiding alcohol and nicotine. A healthy lifestyle can help reduce the symptoms of silent reflux and improve your overall health. Monitoring sleep position. Sleep with your upper body elevated by placing an extra pillow under your upper back area. This can help minimize the reflux of stomach acid while you sleep. Pay attention to trigger factors. Identify personal trigger factors such as certain foods, stressful situations or certain positions that make your symptoms worse and avoid them as much as possible. Regular medical care. Stay under regular medical care and discuss any changes in your symptoms or treatment approaches with your doctor. A doctor can help you adjust your treatment plan to achieve the best possible results. By incorporating these self-care strategies into your daily routine, you can help reduce the symptoms of silent reflux and live a symptom-free life. It is important that you take a holistic approach to treating silent reflux based on your individual needs and seek professional help when needed. Dealing with setbacks and challenges. Dealing with setbacks and challenges with silent reflux can be emotionally draining, but there are strategies to cope and continue to make positive changes. Acceptance. Accept that setbacks are part of the recovery process. It's important to understand that the road to recovery is not always linear and sometimes there are ups and downs. Self-care. Take time for yourself and practice self-care. Do things that bring you joy and relaxation, such as walking in nature, reading, or meeting with friends. Positive self-talk. Encourage yourself and reassure yourself that you have made progress and that you are capable of overcoming these challenges. Flexibility. Be flexible and adjust your treatment strategies as needed. If a particular therapy method does not produce the desired results, you can discuss and try other options with your doctor. Seek support. Seek support from friends, family or support groups. Talking to other people affected can be helpful and make you feel like you are not alone with your challenges. Professional help. Don't hesitate to seek professional help if you feel like you can't cope on your own. A therapist or counselor can help you manage your emotions and provide you with coping strategies. Patience. Be patient with yourself and with the healing process. It may take time for changes to appear, and it is important not to despair if there are not immediate results. Change your perspective. Try to view challenges as opportunities for personal growth. Every setback can be an opportunity to learn and develop new ways of coping. Focus on the positive. Focus on the positive aspects of your life and health. Keep a gratitude journal or be aware of what you are grateful for to boost your mood. Believe in your abilities. Trust that you have the skills and resources to overcome difficult times. Believe in yourself and that you can emerge stronger from these challenges. By applying these strategies and actively dealing with the setbacks and challenges, you can develop a positive and constructive approach to your silent reflux and continue to progress on the path to better health. Exercises for the diaphragm. The diaphragm is an important muscle that plays a key role in breathing and regulating pressure in the abdominal cavity. Here are some exercises aimed at strengthening the diaphragm and improving its function. Diaphragmatic breathing. Sit or lie down in a comfortable position. Place one hand on your abdomen and the other on your chest. Breathe in deeply through your nose, feeling your abdomen expand outward while your chest moves only minimally. Hold your breath briefly, then breathe out slowly through your mouth while slightly contracting your abdominal muscles. Repeat several times to activate and strengthen the diaphragm. Diaphragm stretch. Sit upright and place your hands on your thighs. Breathe in deeply and at the same time raise your arms above your head. Hold this position for a few seconds and feel the stretch in your diaphragm and abdomen. Then slowly breathe out and lower your arms back to your thighs. Repeat this exercise several times to improve the flexibility of the diaphragm. Diaphragm contraction. Lie on your back and bend your knees so that your feet are flat on the floor. Place one hand on your chest and the other hand on your stomach. Inhale deeply while simultaneously pulling your abdominal muscles in and up to contract the diaphragm. Hold this position for a few seconds and then relax the abdominal muscles as you exhale. Repeat this exercise several times to strengthen the diaphragm. Resistance breathing exercises. Use a breathing machine or breathing ball to do resistance breathing exercises. Breathe in deeply through your nose and feel the diaphragm move downward as you breathe against the resistance. Hold your breath briefly and then exhale slowly through your mouth. These exercises can help improve diaphragm strength and endurance. Yoga and Pilates exercises. Many yoga and Pilates exercises aim to strengthen and stretch the diaphragm. Exercises such as the bridge in yoga or the downward dog can help activate and strengthen the diaphragm. It is important to perform these exercises slowly and in a controlled manner and to listen to your body. Start at a moderate intensity and increase over time as needed. If you have any questions or health concerns, please consult a qualified physical therapist or trainer before starting any new exercises. Exercises for proper breathing. Proper breathing is crucial for health and well-being as it increases oxygen levels in the body, reduces stress and improves diaphragm function. Here are some exercises that can help you learn and practice proper breathing. Diaphragmatic breathing. Sit or lie down in a comfortable position. Place one hand on your abdomen and the other on your chest. Breathe in deeply through your nose, feeling your abdomen expand outward while your chest moves only minimally. Hold your breath briefly, then slowly exhale through your mouth while slightly contracting your abdominal muscles. Repeat this exercise several times to activate the diaphragm and promote proper breathing. 4, 7, 8 breathing. Breathe in through your nose for a mental count of 4. Hold your breath for a count of 7. Then breathe out slowly through your mouth for a count of 8. This technique can help reduce stress and calm the mind. Breath focusing. Sit in a comfortable position and focus on your breath. Watch your belly rise and fall as you breathe in and out. Try to quiet your thoughts and focus only on the rhythm of your breath. This exercise can help center the mind and reduce stress. Progressive muscle relaxation. Relax in a comfortable position and focus on individual muscle groups in your body, starting with your feet and slowly working your way up. Tense each muscle for a few seconds and then release the tension while breathing deeply. This exercise can help release physical tension and deepen breathing. Yoga and Tai Chi breathing. Practice breathing techniques from yoga or Tai Chi that promote mind-body interaction and deepen breathing. Listen for breathing instructions during exercises and focus on synchronizing your breath with your movements. Daily breathing exercises. Try to incorporate conscious breathing into your daily routine by taking regular short breaks or consciously taking deep breaths when you are stressed or tense. These short breaks can help calm the mind and renew energy. By regularly practicing these breathing exercises, you can improve your breathing, reduce stress, and promote your overall health and well-being. It is important to perform these exercises slowly and in a controlled manner and to listen to your body. If you have any health concerns, please consult a qualified therapist or doctor before starting any new exercises. How do I protect my esophagus? Protecting your esophagus from damage caused by silent reflux and other factors is crucial to maintaining your health. Here are some important steps you can take to protect your esophagus. Avoid trigger foods. Identify foods and drinks that make your symptoms worse and avoid them as much as possible. Acidic foods, spicy spices, fatty foods, Caffeinated drinks and alcohol can increase reflux and irritate the esophagus. Eat small meals. Eat smaller portions at mealtimes and avoid large meals, which can put a lot of strain on the stomach and increase reflux. Avoid eating before bedtime. Avoid eating large meals at least 2 to 3 hours before bedtime to facilitate digestion and minimize reflux while sleeping. Drink enough water. Stay hydrated by drinking plenty of water. This can help aid digestion and dilute stomach contents, which can reduce reflux. Avoid smoking. Nicotine can weaken the sphincter between the esophagus and stomach and increase reflux. Try to reduce or stop smoking to protect your esophagus. Limit alcohol consumption. Alcohol can increase the production of stomach acid and irritate the lining of the esophagus. Reduce your alcohol consumption or avoid it altogether to protect your esophagus. Avoid tight clothing. Tight-fitting clothing, especially around the abdominal area, can increase pressure on the stomach and increase reflux. Wear loose clothing to avoid putting additional pressure on the stomach. Avoid prolonged bending or lifting. Avoid prolonged bending or lifting heavy objects as this can increase pressure in the abdomen and worsen reflux. Upright posture. Maintain an upright posture when sitting and standing to reduce pressure on the stomach and minimize the reflux of stomach acid. Exercise and physical activity. Regular exercise and physical activity can aid digestion and help maintain a healthy weight, which can reduce reflux. By implementing these measures, you can help protect your esophagus from damage caused by silent reflux and other factors and promote your overall health. It is important to implement these recommendations in consultation with your doctor and to customize them based on your specific needs and health condition. Which foods are harmful? Certain foods can aggravate silent reflux and worsen symptoms such as heartburn, acid reflux, and esophageal irritation. Here are some of the most common harmful foods to avoid. Acidic foods. Citrus fruits such as oranges, grapefruits, lemons and limes, as well as acidic foods such as tomatoes and tomato products, can increase reflux and irritate the lining of the esophagus. Hot spices and sauces. Foods that contain hot spices, such as chili, cayenne pepper, hot sauces and spicy curries, can worsen reflux and increase symptoms. High-fat foods. High-fat foods such as fried foods, fatty meats, fatty sauces and fast food can burden the stomach and increase reflux. Caffeinated beverages. Coffee, black tea, energy drinks and caffeinated soft drinks can increase the production of stomach acid and worsen reflux. Alcohol. Alcohol can irritate the lining of the esophagus and increase the production of stomach acid, which can worsen reflux. Chocolate. Chocolate contains caffeine and may interfere with relaxation of the lower esophageal sphincter, which may promote reflux of stomach acid. Onions and garlic. Onions and garlic contain sulfur-containing compounds that can increase reflux and cause discomfort in some people. Mint and peppermint. Mint can interfere with the relaxation of the lower esophageal sphincter and worsen reflux. This also applies to peppermint tea and other peppermint-flavored products. Carbonated drinks. Carbonated drinks such as soda, sparkling water and other carbonated beverages can increase reflux and cause bloating. Dairy. Some people are sensitive to dairy, especially whole milk and cheese, which can cause an increase in reflux. Choosing low-fat or lactose-free options may help. It is important to note that the reaction to certain foods may vary from person to person. It may be helpful to keep a food diary to determine which foods make your symptoms worse and then avoid them. If symptoms are severe or persistent, it is advisable to see a doctor for appropriate treatment. Which medications am I most often prescribed? For silent reflux, various medications may be prescribed to relieve symptoms and treat reflux. The choice of medication depends on the severity of symptoms, disease progression, and individual patient needs. Here are some of the most common medications prescribed to treat silent reflux. Proton pump inhibitors, PPIs. PPIs such as omeprazole, pantoprazole, esomeprazole, and lansoprazole are commonly used to treat silent reflux symptoms. These medications reduce the production of stomach acid and help relieve heartburn, acid reflux, and other reflux symptoms. H2 blockers. H2 blockers such as ranitidine, famotidine and cimetidine can also be used to reduce stomach acid production. They may be effective in some patients, especially when PPIs are not sufficiently effective or are not tolerated. Antacids. Antacids such as Marlux, Mylanta, Rani and Tums can be used for quick relief from heartburn and acid reflux. These medications neutralize stomach acid and provide temporary relief from symptoms. Prokinetics. Prokinetics such as metoclopramide may be prescribed to improve gastrointestinal motility and help the stomach empty more quickly. This may help reduce the reflux of stomach acid and relieve the symptoms of silent reflux. Mucosal protective medications. Mucosal protective medications such as sucralfate may be prescribed to protect the lining of the esophagus and reduce inflammation. Probiotics. Probiotics can be used to support gut health and reduce stomach discomfort. They can help restore the balance of gut flora and improve the symptoms of silent reflux. It is important to note that the choice of medication should be individual and should be made by a doctor, taking into account the clinical picture, severity of symptoms, medical history and other factors. The use of medications should always be under medical supervision to minimize side effects and ensure the best possible treatment. Which Schussler salts can help me? Schussler salts are often used as an alternative treatment for various conditions, including digestive disorders such as silent reflux. It is important to note that the use of Schussler salts is not supported by all doctors and there is no scientific evidence of their effectiveness in treating silent reflux. Nevertheless, some people may experience subjective improvements in their symptoms. Here are some Schussler salts that may be recommended for relieving silent reflux symptoms. Schussler salt No. 7. Magnesium phosphoricum. This salt is often used to relax muscles and relieve cramps. It can be helpful to relax the muscles of the digestive tract and relieve the symptoms of silent reflux. Schussler salt No. 10. Natrium sulfuricum. This salt is traditionally used to support liver and gallbladder function and to detoxify the body. It can be helpful to support digestion and promote the elimination of toxins. Schussler salt No. 11. Silicea. Silicea is often used to strengthen connective tissue and promote regeneration. It can help strengthen the mucous membrane of the esophagus and reduce inflammation. Schussler salt No. 6. Kalium sulfuricum. This salt is often used to support liver function and detoxification. It can be helpful to promote digestion and relieve the symptoms of silent reflux. Schussler salt No. 9. Natrium phosphoricum. This salt is traditionally used to regulate the acid-base balance and to neutralize excess stomach acid. It can help to neutralize excess stomach acid and relieve the symptoms of silent reflux. It is important to emphasize that the use of Schussler salts for silent reflux symptoms should be individualized and should not be used as a substitute for medical treatment. It is advisable to speak to a qualified doctor or therapist before using Schussler salts or other alternative treatment methods to ensure that they are suitable for your specific situation and will not have any negative effects. Which Bach flowers support me? Bach flower remedies are often used to relieve the emotional discomfort and stress that can often accompany health problems such as silent reflux. Although Bach flower remedies do not directly treat the physical symptoms, they can help reduce emotional distress and improve general well-being. Here are some Bach flower remedies that can help with silent reflux. Agrimony. This remedy is used to support people who hide their inner conflicts behind a cheerful and carefree exterior. It can help people who suffer from silent reflux and suppress their feelings instead of expressing them. Cherry plum. This flower is used to support people who are feeling anxious or distressed and fearful of losing control. People with silent reflux can benefit from this remedy when they are feeling stressed or anxious about losing control of their health. Rock water. This remedy is often recommended for people who are too strict with themselves and their lifestyle. It can be useful for silent reflux patients who tend to criticize themselves or impose too strict rules on their diet or lifestyle. Vervain. This flower is used to support people who feel overly committed and have difficulty relaxing. Individuals with silent reflux symptoms who tend to feel stressed and overwhelmed might benefit from vervain to help them achieve greater serenity. Walnut. Walnut is often recommended as a transitional remedy to help people adjust to change and ward off outside influences. Individuals with silent reflux symptoms who have difficulty adjusting to new dietary habits or stressors may benefit from walnut. Rescue remedy. This is a blend of several Bach flower remedies and is often used to help with acute stress situations or emotional distress. People with silent reflux can benefit from rescue remedy to manage acute stress reactions and regulate their emotions in difficult situations. It is important to stress that Bach flower remedies are a complementary form of therapy and should not be used as a substitute for medical treatment. If you are considering Bach flower remedies, it is advisable to seek advice from an experienced Bach flower therapist or qualified healthcare provider to identify the most suitable flowers for your individual needs and to determine the correct dosage and use. Glossary rights and ownership notice. This audiobook is published and distributed by Testberichtdienste LLC. All copyrights, publishing rights, distribution rights, audio rights, and related intellectual property rights for this work have been lawfully and exclusively acquired by Testberichtdienste LLC. Testberichtdienste LLC is the sole and unrestricted rights holder of this audiobook, including the right to reproduce, distribute, publish, monetize, and publicly perform the content on digital platforms such as YouTube. The original manuscript files, source documents, and contractual acquisition records serve as proof of lawful ownership. The original author and/or their authorized representative, Renovatio LLC, has transferred all relevant rights to Testberichtdienste LLC in accordance with applicable copyright and publishing law. This ownership applies to all current and future uses of this work, including audio, video, and digital publications. Effective date of rights ownership: the 1st of February 2026. Any unauthorized use, reproduction, re-upload, redistribution, or claiming of this content is strictly prohibited. Copyright Testbericht LLC. All rights reserved.